Greetings from Iowa City. I'm Dr. Mike Romano, and I've had the privilege of serving as your president of the Iowa Medical Society for the past year. IMS is here in Iowa City to hand over the gavel and presidential responsibilities to Dr. Mary Grace Elson, who will serve as your new president following this evening's inauguration. I want to take a few minutes before tonight's program to share with you a quick summary of the state of the society. During my tenure as IMS president, we've continued to make significant progress in building the House of Medicine in Iowa, working with my fellow IMS board members and the vast network of physician volunteers across the state, representing IMS, county, and state specialty societies to make a difference in our lives and the lives of our patients. The challenge I made to our membership this time last year was to initiate an enhanced dialogue and encouraged engagement around the need to transform our healthcare system. A tall order for sure on a national level, but less daunting on a state level. As many of you know, this transformation at all levels has been hampered by significant barriers to improvement. There continues to be a need for IMS and its partners to continue to make state and local healthcare transformation relevant and a priority. We need to continue to build awareness on issues affecting the practice of medicine so they can be better understood by physicians and our patients with the goal of assuring the highest quality of healthcare in Iowa. Your IMS has been hard at work creating this enhanced dialogue and have successfully begun to cultivate engagement at the state, federal, and local levels through legislative, regulatory, and administrative efforts. I'm particularly proud of our active leadership in Iowa's State Innovation Model, or SIM, and the Governor's Iowa Healthcare Innovation and Visioning Roundtable. Our close work with the Iowa Healthcare Collaborative's quality improvement efforts, and the substantial expansion of our 4 IMS major initiatives: physician burnout and professional resiliency, 5210 healthcare for childhood obesity, Candor early disclosure programs, and opioid prescribing and treatment education. With this success, we need to continue to build our path through transformation across all patient populations, across all payers, and across all physicians. We have accomplished a lot over the last year, but clearly we have more to do, as outlined in our State of Society update report, which we encourage you to read. It has been another highly successful year for IMS advocacy efforts. As the head of the House of Medicine in Iowa, IMS led coalition efforts with numerous state and national specialty societies to defeat an unprecedented number of potentially dangerous scope expansion proposals, including optometrist injections and surgical procedures, unfettered AR&MP scope of practice expansion, pharmacist-administered pediatric administrations, statin drugs, and mental health services, pharmacy technician-administered immunizations, occupational therapists as mental health providers, hearing loss diagnosis and treatment by any licensed healthcare provider, regardless of training, and independent practice for physician assistants. While the legislature has not yet adjourned, we are also encouraged to see that we are within striking distance of eliminating prior authorization for Medicaid coverage of medication-assisted treatment to help address Iowa's opioid abuse problem. We continue to fight alongside numerous patient and provider groups, as well as the governor, for the establishment of a framework for a true integrated children's mental health system in Iowa. We are working diligently on legislative effort to craft realistic, bipartisan solutions to the problems plaguing Iowa's Medicaid managed care system. We continue to lead healthcare efforts to combat pediatric obesity through ongoing state funding to support the 5210 initiative and the IMS-led technical assistance to grow the skills in this area for primary care physicians throughout the state. We're also fighting at the state and federal level for policy measures and funding to address our physician workforce shortage, including funding for the Rural Primary Care Loan Repayment Program, proposed federal changes for greater flexibility in the Conrad 30 program that recruits foreign medical graduates to practice in rural communities, and finally, action to address the cap on graduate medical education funding that has been frozen since 1997. And speaking of relics of the 90s, IMS is also continuing to lead the charge to address the geographic disparities in Medicare payment rates through the elimination of Medicare gypsies that have disproportionately impacted Iowa physicians for nearly 30 years. Working with Senator Grassley, we've successfully pushed for a GAO study to examine the flawed data and inappropriate assumptions that form the basis of the gypsy calculations. This report, expected in early summer, will help us build the case to finally address this long-standing problem. But in order to continue our strong work on the advocacy front, we need each of you to join IMPAC, the Iowa Medical Political Action Committee. As you all know well and have just heard, Congress and the Iowa legislature make decisions that regulate and shape our profession every day. It's critical that we elect the candidates who will best represent our interests and those of our patients. And this past election cycle was a banner year for physicians getting involved in government. We had an impressive roster of physicians on the ballot in 2018. We were especially thrilled when our own Marionette Miller-Meeks, an ophthalmologist from Ottumwa, IMS past president and our first female president, was elected to the Iowa Senate. She's been working with our leadership and the staff this past legislative session to pass many of the items important to our membership. By supporting these candidates, IMPAC helps assure pro-medicine candidates have the resources they need to stay in office and fight for high-quality health care for Iowans. As I noted, during the past year of my presidency, IMS has expanded our major initiative work: physician burnout and professional resiliency, the 5210 Pediatric Obesity Initiative, Candor early disclosure programs, and opioid prescribing and treatment education. I'm pleased to report this past year, the Physician Burnout and Professional Resiliency Initiative has expanded to become a comprehensive program, which includes a number of valuable resources for professional medical community. The IMS Burnout Program consists of 12 regional awareness programs hosted across the state of Iowa and in partnership with the Iowa Pharmacy Association. The awareness program is an interactive session to help physicians determine where they fall on the spectrum of physician burnout, to see how burnout affects their team, and to learn some valuable self-care and management skills. To date, IMS has been in 3 communities with the awareness program and will conduct 2 more visits later this month. Following the awareness program, IMS has additional programming that can be self-selected based on individual needs. These include peer support groups, leadership training, one-on-one coaching, and organizational development. To date, IMS has launched its first topic for the peer support groups, announced 2 dates for the Learning to Lead Without Leading to Burnout events, and has even directed a physician on where to receive one-on-one coaching. In addition to this awareness programming, IMS continues to fight at the legislature with employers and with insurers to address the underlying factors that contribute to burnout in the first place. This past summer, IMS jointly hosted 4 Candor training workshops with the Iowa Healthcare Collaborative. 15 facilities across Iowa attended the 4 days of training and are now continuing to facilitate the conversation on implementing Candor and using IMS support services. The 5210 Pediatric Obesity Initiative has also expanded across the state. With the 61 clinics and a total of 343 healthcare providers registered, the 5210 Healthy Choices Count message is now reaching over 168,000 pediatric patients. IMS is continuing to provide educational webinars on the prevention and treatment of childhood obesity. And new this year, IMS has introduced a major initiative on opioid education. IMS will be hosting a summit in Dubuque next week to give attendees practical and productive skills to respond to Iowa's rise in substance use disorder. The summit is offering 4 hours of live MAT waiver training, CDC prescribing guideline training, and will convene national and local experts to provide resources and tools on topics regarding substance use disorder. IMS membership numbers are strong, and we do have an incredibly strong footing, but we still have a lot of work to do in order to demonstrate to Iowa physicians the value and relevance of IMS membership. All of us at IMS wish we could personally share our accomplishments with every Iowa physician. We need all Iowa physicians to support us and help us spread the word to your colleagues about the strong value IMS brings to the physician and patient communities in Iowa. On the financial side of IMS, we continue to make new investments in strategic partnerships like the Iowa Medical Insurance Group and have streamlined the organization, maximizing our efficiency and exploring new ways to do business without reducing our level of service to our 6,900 members. As such, in 2019, we are financially secure and are exploring additional partnerships to further strengthen our position. Before concluding, I'd like to take a moment to acknowledge all of my colleagues, both past and present, who have proactively sought and accepted IMS leadership roles. These individuals, our colleagues, give of their valuable time and expertise to provide direction and leadership to IMS and to our profession. I'm so proud to serve alongside these impressive individuals. It's been an honor to serve as president of the Iowa Medical Society. I'm equally honored to turn the reins of this vibrant organization over to Dr. Mary Grace Elson, who will ably lead us into the next year as the 170th IMS president. Thank you.